No. Okay. So let's talk about the acute abdomen. Some of this we're going to kind of review from the human body. So we're going to still talk about quadrants and what's in each quadrant and so on and so forth.
What's our game plan? A nod?
Oh, something. Okay, so acute abdomen basically is the general, is the name for presence of signs or symptoms of inflammation in the abdomen. Okay, it's kind of what we're going to call it. All right, so anatomy. Let's not forget what's all in the right upper quadrant. Okay, don't forget your kidney kind of sits in that back. Okay, but it's still considered in the right upper quadrant. Okay, left upper quadrant. Remember, it does have part of the liver in it, but it's kind of like that tail part of the liver. Okay, spleen. Okay, obviously the kidney, stomach, colon, pancreas. Okay, lower quadrants. You're going to see some extreme similarities. Okay, the kidneys kind of set right on that line between the upper and lower quadrants, so they're in both, or technically all four quadrants, kidney. And then colon, because the colon kind of outlines my whole abdomen, right? Kind of comes across, down, or up, across, down, and over, if you will. Small intestine take up a lot of my lower quadrants, okay? And then major artery and veins that run to the leg. Don't forget about your ureters. Appendix is in the right. And then if you're female, you're going to have ovaries, fallopian tubes. You're also going to have the uterus that sits down in the kind of in the middle there with the bladder. Also running in the middle, or that midline area, your spine, aorta, pancreas, etc. Sir? Okay, go ahead. All right, so you guys remember solid and hollow? Okay. Tell me by raising your hand. Please don't everybody shout it out. Raise your hand if you think you can name. Go back, go back, go back. Okay. Raise your hand if you think you can name hollow, solid organs. Brian. Organs. That's multiple. Mason.
Spleen, liver, pancreas, kidneys.
Okay. How about hollow organs? Destiny?
Your stomach, your small, large intestines, and your bladder.
And your bladder. Okay, let's see. Let's see, did we get it? Spleen, liver, pancreas, and kidneys. Excellent job, Mason. Did you read it from your slideshow presentation?
No, I don't have this one out.
Wonderful. Hollow organs. We forgot gallbladder, right? We did hit stomach and large intestine. The duodenum is part of that, kind of where the stomach and intestine meet. Small intestine and bladder. Excellent. This, I think, is a very difficult picture to see. Okay, and this is obviously on a carcass, on a cadaver. That you can see the intestine and how they look kind of all bunched up like rope, I guess.
No, like that hose.
I was actually thinking the garden hose, but I thought nobody would know what I was talking about.
Yes, thank you.
It's
the green one, and you
plug it in and it grows.
Yeah, and then it shrinks back up to its normal size.
It's supposed to fit in your pocket and then it expands up to like
Yes.
50 feet or something like that.
I want to know if it works. Go by it and tell me.
I want one really bad.
Next.
You would.
All right. So determining the exact cause of why they're having an acute abdomen or why they're having abdominal pain isn't necessary, generally speaking. We do want to kind of narrow it down because that might change some of my treatments, right? But that's going to be based on, my treatments are going to be based on the signs and symptoms anyway, which could kind of lead me down that path, right? Excellent. So that's that important factor, is recognizing when it's acute. Okay? So what are we talking about when we talk about an acute abdomen? How about needing surgical intervention? Okay? That's kind of one of the ways to think about it. When it's severe and it needs surgical intervention, you kind of need to be able to recognize bad sick. Okay? So, where do you hurt? No locations of your major organs, which we just kind of talked about, right? Remember, it's the patient's left and right quadrant, not yours. Okay? But realize that pain locations don't always correlate with kind of what's there. Right? So we have, do you guys know what kind of pain that's called?
Deferred.
Deferred. Okay? Or referred pain, either one. Okay? So what does the pain feel like? Steady pain is an inflammatory process, but a crampy pain is more obstructive. And the way you kind of think about that, and I know nobody likes to think about it, think about the last time you've ever had diarrhea. You got crampy, right? That's why. Okay? So, did it start all of a sudden or was it kind of slow? If it was sudden, this is probably an infarct, because you can actually infarct even bowel. So if you have there are certain things that can happen to like your intestine where it cuts off blood flow or blood supply, some blockages. So you can actually infarct your bowel and have part of your bowel die off where they got to go in and do surgery and resect. So sudden is perforation, hemorrhage, or infarct. Okay? And then that gradual is going to be that peritoneal irritation. Do you guys know what the peritoneum is? Or what the... Yeah, it's kind of like that lining. Yep. All right. Or hollow organ distension. Right? And the way you think about that is if you eat so much that you distend your stomach, it's a gradual kind of like, then all of a sudden you're like, ugh. You don't go from, oh my gosh, right now. Right? So that's one of the ways that it will hopefully help you remember this.
What's the period?
Peritoneum is kind of like the lining, the intestinal lining. Okay, does it radiate anywhere? So, if it goes to the right shoulder or the angle of the scapula, the right scapula, that's generally a gallbladder problem. Okay? If it goes around the flank to the groin, we're talking kidney or ureter. Okay? So that can happen with either a UTI or stones, which would be more of a ureter problem. Okay? So, how long has it been going on? Is there some surgical significance or not? Nausea and vomiting? Is there blood involved? Okay? Blood, when we vomit it, if it's been sitting on our stomach, it doesn't take very long, but if it sits in our stomach, it oxidizes and it looks like coffee grounds. And I mean that as literal as I can mean it. So how many of you guys are coffee drinkers? How many of you have ever seen the coffee grounds in the that's exactly what it looks like, only it's got that red tinge to it. It's the same consistency as wet coffee grounds. Okay? So any blood in the GI tract is emergent until proven otherwise. Right? It's a non-compressible hemorrhage. Okay? The more predominant the flow and the higher the flow, the less likelihood it's going to oxidize. Okay? That's why when we talk like varices, esophageal varices are bright red. It doesn't go down in the stomach. It just comes out. Okay?
Have you ever seen blood meal?
Have you ever seen what?
Blood meal.
Blood meal?
Yeah. I think that would pretty much be exactly what bloody vomit looks like. It's something you feed to cows.
Oh, yeah, no, I haven't. But it looks just like wet coffee. It looks like coffee grounds, like out of the, sometimes it's bright red, and then again, it's the more of brisk bleed, typically higher. All right, so you need to ask some very uncomfortable questions, like changes in your urinary stuff. So are you going more frequently, would be a pretty significant question. You want to know, what does it look like? Does it look like tea? Okay. Urine can actually look like tea. That's usually significant for like a UTI, presence of blood. Okay, but not always. Changes in the bowel habits, and then appearance of bowel movements. What does it look like? Are you going more often than usual? See, blood in the GI tract kind of causes two things. It causes emesis and it can cause diarrhea. It's an irritant. Blood outside of the vascular space is an irritant. It's kind of almost a caustic substance. Okay? So when it gets into my GI tract, it's going to cause me to have to go to the bathroom or to vomit. Okay? When we talked about the oxidization process and what it looks like when I vomit, but when I have a bloody bowel movement, it looks like what they call melena. The way to describe that is like that dark, tarry stool. And that's exactly what it is. It's very dark and it's kind of like tar. Okay? And this is so disgusting, but I'm going to tell you. You wouldn't realize probably that it's a really dark maroon unless you did a guaiac test, which is what they do in the ER, where they kind of take a sample and rub it on this little card.
So they put the solution on it.
Yep.
It turns whatever color.
Yep.
It's blood.
Yep. And that's usually when you'll see the true color of melena. Okay?
I had this one patient I saw, and they had problems in the ER, and asked them about this, about color problems, where she said it was bright red blood.
Typically, I would be inclined to think it's probably lower in the GI tract, so it didn't sit in the GI tract long enough to oxidize, or hemorrhoid. Hemorrhoids bleed bright red blood.
They can bleed all along.
Yes, they can. They actually can. Okay?
Or you have diarrhea and you ate the red Cheetos.
And that could be as well. I'm not being disgusting, but it's true. I will tell you that a GI bleed has a very distinct smell, and it's not a smell I can describe to you, but I can tell you it has a horrible smell that's pretty distinct. Okay? So regardless of the underlying cause, vomiting or diarrhea can be a problem because of associated volume loss. So let's talk about this for a second. The flu. Is the flu deadly?
Can be, especially in elderly.
Elderly and who else?
It is.
Do you know what kills them? It's not the flu.
It's the diet.
It's the dehydration. Okay? So same concept. And I know you're going to be out there on the ambulance sometime, and somebody's going to go, you're going to get the call for vomiting, and you're going to be like, really? You're calling me for vomiting. It can actually be, significant, so you need to make sure you get the whole story before you start kind of going, this is ridiculous. Just get in the truck and let's go. All right? Females. Yes, gentlemen, you're going to have to ask, again, some very uncomfortable questions. Make sure you realize who you're asking these questions in front of. Okay? Be very aware. She may not be forthcoming with information. Okay? So you want to ask her, when was your last normal menstrual period? Okay? And it's very important to ask about normal bleeding, and we're going to talk a little bit more about it when we get into like OB. But for an example, did you know that pretty close to the time of a woman's expected menstrual cycle, if she actually implants a zygote, which is a baby, she can actually have some spotting, which a lot of women confuse with the period. That's called implantation bleeding. So it's really important to ask if she says, it was lighter this time. That should be something kind of in the back of your mind.
Don't you also cramp too, though, when you implant?
Sometimes. It depends on the person, because not everybody has implant bleeding.
And you can cramp and bleed your entire pregnancy.
Yes. Okay? So, females with abdominal pain equals a GYN problem until proven otherwise, period, end of discussion.
Is that why they always give you the stupid test in the ER even if you don't need it? The
Yes.
pregnancy test?
Yes. Plus, they also have to confirm that you're not pregnant before they put you under x-ray. Because a lot of abdominal issues get x-rays because they can look for blockages or free air and this kind of stuff. You can't be exposed to radiation until they've confirmed it.
Gotcha.
What happens if would you say you can have cramping and
Bleeding your entire pregnancy.
you keep taking the pills?
We will so get there. But taking the birth control pill actually when you're pregnant can have an effect on the way the fetus develops. Okay, so vital signs. Tachycardia. Are they in early shock? That's more important than blood pressure, and we know this from trauma, don't we? When does blood pressure start to show issues?
Usually not till the end.
Late. Okay? And we don't want to wait till late. All right? And then rapid or shallow breathing is peritonitis. That is, I don't want to move, and movement hurts. When I have that irritation of the lining, Every movement hurts. Those are the people that are curled up with their knee and they don't want to move. Do you guys know what I'm talking about? Have you ever had that? Okay. Tilt test should be done with a non-traumatic abdominal pain. You guys know what a tilt test is? Okay, it's also called checking orthostatic vital signs. Okay, so what are we going to do? We're going to lay them flat, and they need to lay there for about a minute because it takes about a minute for my blood pressure to kind of stabilize. Okay, and then I'm going to assess two things. I'm going to assess, essentially, your blood pressure and your heart rate. So what should my blood pressure do if I'm laying flat? Go up. Right? So when I'm laying flat, my blood pressure is going to be higher. Okay? So as I sit up, what should I expect to happen? It should go down a little bit. Right? So more than a 20-point variance of either is considered a positive tilt. Let me tell you this. And I always tell my patients this. If I'm going to assess a tilt, and I'll do it real nonchalant, right? I know you don't feel good. Let me get your vital signs while you're laying here. Okay, now I'm going to set you up. I want you to let me know if you get dizzy or anything like that. And I'm going to let you sit here for a minute because guess what? How many of you guys have ever been bent down or squatted down for a really long time and stood up really fast and it kind of starts to go black on you? Okay, that's what happens. So anytime they start to feel like they're going to pass out, or they get dizzy or lightheaded, stop your test. That's a positive. It's going to be considered a positive tilt test.
You said more than how many points?
Typically it's 20. Maybe 10. I think it's 20. Okay? So the general appearance, if they lie perfectly still, this is inflammation or peritonitis. Again, everything hurts. All the movement hurts. Okay? If they're restless and if they're kind of writhing and okay, that's going to be more of an obstructive process. Okay? And then look at their general impression overall. Okay, then you need to inspect. What are we going to look for in the abdomen? Yeah, how do we know if they're distended?
Would you be able to feel the unevenness in it? Would it be tighter?
Might be a little bit tighter, but yeah, you might have to ask them. You might have to go, okay, is this normal for your tummy to be this, I would refrain from saying, is it normal for your tummy to be this big? Okay, but just kind of is this normal for your tummy? Is this the normal size for you? And you want to feel and go, your tummy feels a little bit tight. Is that normal? Some people it is. Okay, even if they're large. Okay, so you're going to check for distension. Ecchymosis. Bruising. Bruising around the umbilicus or the flank. Where are my flanks? Okay, where's my umbilicus? The belly button. All right. Bowel sounds. Listen for 1 minute in each quadrant. Again, this is, okay. How many of you guys have started doing ambulance stuff? How hard is it for you to hear in the truck? Yeah, absolutely. Bowel sounds are going to be even more difficult to hear in the truck. Okay? Again, this isn't something, if they're having an acute issue, I'm not going to delay to listen to this. Okay? So listen before feeling. Absent bowel sounds is usually ileus, peritonitis, or shock. Why shock? Yeah, and it goes into that. Remember we talked a little bit about feed and breed or fight or flight? That epinephrine causes that fight or flight, which then, in turn, kind of decreases blood flow to my gut. It doesn't need to digest that steak. What it needs to do is it needs to be here supporting my circulatory system, my brain function, my heart. Make sense? Yep. Excellent. And you also need to do it before you're going to palpate. Ouch. Auscultating bowel sounds has no need in a trauma setting for pre-hospital at all. Okay? So don't delay ever on a trauma patient to try to listen for bowel sounds. Okay? I was going to tell you something else. Oh, when you palpate the part away from where it hurts. So you want to ask them, where does it hurt and does it go anywhere? So if it starts here and moves here, I don't want to start palpating here or here, right? Because then it's going to start hurting and then your whole assessment's done. Then they're going to get that referred pain everywhere. My whole belly hurts now.
Would you also not auscultate the area that hurts first?
Not first, yeah. You don't want to do any of that first. Okay? Yes. Absolutely last. Thank you, Vicki. All right. So look at this. Palpate each area of the quadrant working towards the pain. Try to warm your hands, okay? Ideally, you want to put them on their back with their knees bent if possible. Okay, that's generally where they're going to be most comfortable. Also, it takes some of the pressure off their lower back. Okay. Note tenderness, rigidity. So, is it hard? Okay. Any involuntary guarding. Now, what does that mean? Yeah, when you touch it and they do this, that's guarding. That was kind of reflective more than intentional. It was just that reaction that they had. Okay. And then also voluntary guarding. So if they're going, don't touch me here, don't touch me here, don't touch me here, it hurts. Okay? Or masses. So when I palpate, that's what I want to feel for too, is do I feel any big lumps? Okay? So what are we going to do? Oxygenate better than 94 or better. Anticipate vomiting. Don't give them anything by mouth at all. Not even a sip of water. Okay? And then anticipate hypovolemia. All right? Mm-hmm. How do we know that? What are some things we're going to look for? Huh? Cool, clammy skin. Tachycardia. Okay, contusions, possible trauma. Something I want you guys to take note of. What happens when we have pain?
Heart rate goes up.
Heart rate goes up. What else? Typically, your blood pressure goes up as well. Okay? So if you're looking at this patient and kind of going, are they tachycardic because of pain, or are they tachycardic because they're bleeding somewhere, they're hypovolemic? Okay? We need to be looking at some of those things. Okay?
It's also with an acute abdomen. She was in a lot of pain. Her heart rate was like, I think it was like a 205.
That's extremely high, even for a pain.
Yeah, she was in immense pain. And I don't know why the doctors took so long to address the pain as they did.
Well, sometimes you got to make sure that that's really what needs to be addressed.
Yeah.
Because is it really abdomen, or is she having a cardiac issue that's referring to abdomen pain?
True.
Okay, so there are some things that you got to rule out there. Okay. Again, adults greater than 30, you got to consider that abdominal pain is actually referred cardiac pain. Okay? All day, every day. And then females, consider obviously a GYN problem, especially tubal ectopic pregnancies. Do you know why we assume it's a tubal ectopic pregnancy? What'd you say, Sean? Yeah, these ladies, depending on what part of the tube it's in, can bleed to death in minutes.
Are we going to learn more about that?
Yes, in special patients.
Okay.
Yep, we certainly will. Okay, so appendicitis. That is a nasty looking appendix. Okay, so this is usually due to obstruction, basically with fecal matter. Yeah, ew. And then it becomes swollen and inflamed, kind of sometimes gangrenous, okay, infected, and it can possibly perforate. That's very bad. So what do you think happens? You know what, I'm getting ahead of myself. Go ahead. Pain begins around the periumbilical area, which would be kind of around my belly button. Usually it starts there and it kind of migrates to that right lower quadrant. Okay? They're going to have nausea, vomiting. Now when they talk about anorexia, as it pertains to stuff like appendicitis, yeah, they're just talking about they're so sick, they have no appetite, they don't want to eat. Right? That's one of the things that we're going to look for here. Okay? They tend to lie on their side with their knees flexed, you know, kind of drawn in. Okay? And it may not be localized to the right lower quadrant if it's in an odd location. And there's a percentage of the population that their appendix is actually on their left side. Strange, but it does happen. Okay, if they say it's been hurting, and all of a sudden they have a relief, it just perforated. Now, the next time they start having pain, it's because they have a raging infection. They're probably going to be septic. Okay? Ma'am?
My mom always said if it was your appendix and you like were standing on a step and you jumped down, it hurt worse?
There is a name for that sign, and I don't even remember what it is, but I'll look it up because I don't remember what it is. When I worked at the Children's Hospital, everybody who was suspected of an appendicitis, the doctor would come in and the first thing they did was slap the bottom of their right foot as they were walking up. If they writhed in pain, that was a positive sign. It was probably the appendix.
Okay. I was just curious. She'd always told me that, and I thought, that's hooey.
Nope, it's absolutely true.
Okay.
Absolutely true. So pain from hitting like the right heel is, and I'll look it up, but it's actually a sign. Okay.
His right hip, that's what they're laying on, or just guarding basically?
With their hips, they're laying on the right side, and their hips are flexed, their knees are flexed, and yeah, they're kind of curled up. Go ahead. Duodenal ulcer disease. Okay, this is that steady, well-localized epigastric pain. All right, burning, gnawing, aching. All right, increased by coffee, stress, spicy foods. Okay, it's an ulcer typically.
Where?
In the duodenum. Remember we talked that the stomach kind of comes in and then it connects to.
Small intestines.
Okay, and it's decreased by alkaline foods. What would be an alkaline food or drink? What? Acidic. That's acidic. Milk, yogurt, those kind of things. Absolutely. Okay, and antacids typically make it a little bit better.
Question. I have acid reflux.
Okay.
So is that something leading to duodenal ulcer disease, or is that already the case?
It's different because you probably have an excessive amount of acid.
Okay.
So
I know that anytime I drink beer, anytime I drink coffee, I mean, some days it's worse than others.
you just said, sure.
Yeah.
I mean, don't drink beer or coffee. I mean, that's exactly what I was going to say. Go ahead.
Tequila, that'll hurt the whole time.
Actually, vodka's the worst.
Really?
First sip of vodka, oh.
All right, so duodenal ulcer disease can cause actually a massive GI bleed. Okay? And then perforation is this intense, steady pain. They're going to lie extremely still, and they may have that rigid abdomen. Now, remember, rigidity could be, I push on it, it's hard, or maybe they're kind of flexing to guard it. Okay?
So if they're flexing to guard it, that is still considered a rigid stomach?
I would consider it guarding, yeah,
Okay.
or rigidity, either one. Okay, so kidney stones. Those of you guys who drink a lot of sodas, okay? Kidney stones are basically mineral deposits that form in the kidney, and then as they move through the ureter, they look like. Have you seen a puffer fish? You guys know what I'm talking about when I say puffer fish? The little fish that when they lay down, they're good, but when they get all excited, they puff out. They got those little spikes.
I almost thought I saw the perfect representation of it, stickerbear or something like that,
Cocklebur.
or whatever they're called. They're like just little bitty pellet
Yes.
size, and they got spikes all over.
Yes, that's exactly what a kidney stone looks like. So when it goes through the ureter, it causes intense pain as those little sticky things scrape the ureter, which is also why it hurts when it's on the move and you get blood in your urine. It also can be associated with a history of UTI, severe flank pain radiating around to the groin or the scrotum. Okay, gentlemen tend to not get UTIs as often as ladies do. So if a guy has flank pain that radiates around to the groin or the scrotum, I'm thinking probably a renal calculi or kidney stone.
So if God has this, he's got to piss out that sticker.
So do women. And they will often give you a little, like a strainer that you have to pee through to get your stones.
Take it home and put it on your shelf.
Yes.
They just take the kidney.
Also, nausea, vomiting, and hematuria. You guys remember what hematuria is? Blood in the urine. Excellent. And then extreme restlessness. This hurts. I have been fortunate enough not to have a kidney stone. Knock on wood or whatever I've got local here. But they say that this is as close as a man will ever come to delivering a baby. They relate this to giving birth.
Have you seen the Seinfeld episode where Kramer gets a kidney stone?
No. All right, go ahead. All right, so abdominal aortic aneurysm. All right, so you remember that your aorta kind of comes down right in the middle, okay? And your kidneys come off, so the abdominal aortic aneurysm happens below the kidneys, just as it says right here. Okay? Localized weakness of the blood vessel wall, kind of like a bubble on a tire. So there's several different layers, and it's kind of like where you get that weakened place, and then it kind of starts to fill up that outer layer. That's how you get that bubble. Does that make sense? Mm-hmm. The weakness kind of pushes through it. Okay? Pulsating masses in the abdomen, if they have one that you can see, don't touch it. Okay? Do not touch it.
How would you be able to see it?
Sometimes you can. Sometimes you'll see it pulsing.
Oh.
Yes. Okay? And it can cause pain in the lower back. If it ruptures, generally based on the size, they will exsanguinate quickly. Okay?
What does that mean?
Bleed to death.
Alright.
Yep, absolutely. So again, it can cause lower back pain. Okay? Go ahead. Pancreatitis, this is basically inflammation of the pancreas, triggered by ingestion of alcohol or large amounts of fatty foods. All right. Nausea, vomiting, abdominal tenderness. You guys remember where the pancreas is? Where's it at?
Left upper quadrant.
Is he right?
I thought on the right. You're right.
Gosh, you guys better look.
Gosh, we better.
Gosh.
Pancreas is the left upper quadrant, folks.
Bang. But, does a little part of it go over into the right upper quadrant?
Yeah.
I can't lie, it sure does.
Okay. So, the major part of it's kind of like my liver. It starts in one quadrant and kind of goes over to the other side. All right? So, it's going to cause vomiting, abdominal tenderness, kind of over the pancreas. All right? Pain radiating from the upper abdomen straight through to your back. And that's one of the questions I ask people. They go, oh, it hurts, it hurts, it hurts. And I go, where does it hurt? Oh, right here, right here. Does it go anywhere? It goes to my back. Does it wrap around? Or does it go straight through to your back? They can tell you the difference. Okay? And then signs and symptoms of hypovolemic shock.
If it wrapped around, what would it be?
Could be several different things. Could be muscle.
Okay.
Yeah.
Okay. I just wanted to know where to go from that.
It depends on their other. It depends on their other stuff.
Okay.
All right. Cholecystitis. This is basically inflammation of the gallbladder. Okay, or gallstones. Commonly associated with gallstones. More common, 30 to 50-year-old females. So pardon my. Hope I don't offend anybody. So there's a way to remember this. Fat 40 and female are huge proponents for gallbladder disease. Pregnancy is also one because of decreased gut mobility can cause a backup and cause stones. Okay, so it's not uncommon for even women who aren't fat or 40 but are pregnant to have some complications here. Nausea and vomiting, this is that right upper quadrant pain. They can have tenderness and fever. Now, this is usually triggered by fatty foods, and it can last anywhere from like 15 minutes to several hours. And it's very painful.
How do those get made? What is it that, is it fat?
Yeah, I think so. I think it's like fatty deposits.
Poop them out or something?
No, they get stuck. So here's what happens. They block that common bile duct, so you get like a bile buildup, right? Because that's what the gallbladder does. It dumps the bile into the stomach. So that I can digest those fatty foods. Well, if I have that stone that's blocking that, I'm going to get a lot of pain and have difficulty digesting. Okay?
If you ever get one, there's a place that you can sell them to. There's a show on TV that has that it's like bizarre something or weird something, and it's in New York, and these people will buy gallstones and they make necklaces of them.
Oh, that's
Ew.
That's just disgusting on multiple levels.
What kind of TV do you watch?
I know, right?
It comes up
All right.
on one of the learning channels.
Let's talk about bowel obstructions for a minute. Your elderly folks are extremely high risk for bowel obstructions. So are little kids, but you'll see this a lot in elderly people. Okay, it's the blockage of the inside of the intestine. Okay, and it interrupts the normal flow of the contents. Okay, which is what we end up forming into bowel movements or stool. Okay, causes include adhesions, hernias, fecal impactions, which is why our elderly folks have a hard time, or tumors. So basically, anything that's going to kind of block or impede the flow through the gut. Okay, fecal impactions can be caused due to slow-moving bowels and or dehydration. Right. So that's why you got to be careful when you take things like Mucinex that you don't get you don't get constipated because it pulls all the fluid, all the water out. That's why you got to watch for Mucinex. Okay, for example. Does that make sense? You know what I'm talking? How many of you guys have taken Mucinex? That's why they tell you. Yep, that's why they tell you to take lots of water with it because it draws out your water and it kind of will dehydrate you. Okay, so this is going to be that crampy abdominal pain because remember, obstructions or blockages generally are crampy. Okay, pain, nausea, vomiting. Yes, they can actually vomit fecal matter. And it has another horrific smell. Okay? But it basically is the body's got to get rid of it somewhere, and it's backed all the way up, okay, into the stomach.
I was learning in A&P that when you have that deep vomiting, like when you
Bile.
too much alcohol, well, they said it's also that, I can't remember the actual name of the opening for the small intestine, but you're actually getting some bit of that pre-fecal matter.
Awesome.
It's coming through the stomach all the way up.
And they'll also have abdominal distension because of the backflow, right? Because of the buildup. Okay?
Is it the poop baby that you see on the ultrasound?
Yes, it is the poop baby that you see on the ultrasound, Cody. All right, esophageal varices. This is important to know because people die of this. Okay, this is bad news. Okay, so this is basically dilated veins in the lower part of the esophagus, common with alcohol users because it kind of thins that. Okay, or patients with liver disease. This produces massive upper GI bleed. Massive. And look at what it says. Dilated veins in the lower part. So it's actually, like they vomit like bright red blood. Okay? Go ahead. Oh. Questions?
I was going to ask a question about that picture. I know it's obviously the form. Is it really supposed to look all that bubbly? Where are the bubbly looking things?